to open the afternoon, I get to introduce someone whose credentials uniquely position him to talk about the issue of hospital prices. Howard Rothschild is president of the Realty Advisory Board on Labor Relations and serves as co-chair on the 32BJ funds. In that dual role, he helped establish the Labor Industry Cooperation Fund, a collaboration between labor and management to tackle hospital prices together. Howard will share how the fund achieved healthcare cost increases at half the national average, the battles they fought against anti-competitive hospital prices, and why accepting the status quo isn't an option. Okay, please join me in welcoming Howard Rothschild.
Thank you for that kind introduction, and I feel I'm off to a great start. I didn't trip on this step coming up here. So I'm Howard Rothschild, the president of the Realty Advisory Board. We are a multi-employer association. We represent many employers in New York, and I also serve as a trustee on several union health and welfare funds, including the 32BJ fund. I hope you've enjoyed the conference so far, and hearing from Manny Pastreich about our long journey in trying to seek change and rational pricing, and also from Mark Cuban, who was just a wonderful interview talking about direct contracting and cash payments, as well as the elected officials about neutral site legislation and health policy considerations. Later this afternoon, there will be more experts who will provide more detailed insights. But first, I wanted to give you my perspective as a trustee on the fund and also a representative of employers in collective bargaining. As a representative of many employers, what I do is collective bargaining and union contract administration. As someone once said about healthcare, it's complicated. My hope is at the end of this presentation, you will come away with a couple of good ideas and just not accept the status quo. Our contracts with 32BJ and other unions cover over 100,000 workers and their families, and they provide good wages and great benefits. But I wanted to start at the end because that's the part that matters most. Our cost increase for health contributions averaged less than 4% over the last 5 years, and they're budgeted to rise 2.5% over the next 3 years. And for those of you who deal with union contracts, when I say budget, that's a hard number. It cannot exceed that number. That's the number. Those numbers represent less than 50% of the national average. We've done this without pushing costs on our employees. In fact, employees under our contracts currently do not pay 1 cent for healthcare premiums. Many do not pay copays or deductibles if they stay within the network. Most employees today face a very different bargain in obtaining healthcare coverage. So this is not one of these things where it's 3-card Monte down the sidewalk in New York where you're pushing costs from here to there. No, we have hard stops in terms of how we pay for things and how much things cost. We've achieved this by focusing on numerous issues, including the cost of hospitals and anti-competitive practices. This is a focus of our fund. Hospital prices are rising at unsustainable rates and comprise the vast majority of our spend. 4 years ago, we compared quality hospitals in New York City. One was charging $83,000 for a hip replacement, while a comparable hospital charged $58,000. Eliminating that high-priced hospital from our network resulted in annual savings of $35 million. That's for 4 or 5 years in a row now. So this is not small change. This is real money. The consequence for that action resulted in a strained relationship between the hospital and the fund. For instance, when we tried to switch to another TPA, the hospital claimed we owed them $25 million, and we would have to pay that to keep them out of network. When we asked for details and clarification for what this $25 million was for, they were unable to produce much of anything. In response, the Labor Industry Cooperation Fund ran a campaign to expose that hospital's pricing and their tactics. Ultimately, they backed off, but they forced us to choose another TPA. On the bright side, our campaign apparently spurred others on. That hospital's practices are now part of 2 private civil lawsuits by 2 other union funds, as well as an investigation by the Department of Justice. Through the LICF, we've created alliances with other payers of healthcare and the government. It's no surprise that this has led to legislation that is helpful in terms of transparency, pricing, and adjudication of claims. In addition, through events like today, diverse individuals and organizations can exchange ideas and best practices. There have been a proliferation of litigation against improper hospital practices, both by payors and the government. On what planet would a customer have to pay a higher price, sometimes 5 times as more, for services than the published rate of the vendor? It's like going into a car dealership and seeing the MSRP, and then the dealer saying, oh no, it's 5 times the MSRP. It's like, where would that happen? Imagine going to your family doctor for years, whose practice gets sold to a hospital. The building is the same, the doctor is the same, but the charge is now 4 times what it was for routine medical services. Monopolistic price increases through hospital and private equity takeovers are costing payers billions of dollars. No one wants to get ripped off, and we need to eradicate these practices. This is not just an issue for our fund or even limited to private payers. The government has an interest in protecting employers because the government is also a large employer and a payer and is victimized by these practices. One of the speakers earlier today said if one thing had changed in terms of pricing, New York City and state would save at least $200 million a year. We heard that Vermont instituted pricing reforms to examine cost growth and implemented policy leadership to solve this issue. As a result, payers are analyzing the issue, and there's good news on the horizon. For example, our fund engaged in direct contracting with some hospitals relating to organ transplants, joint replacements, and some surgeries. This has not only saved our fund millions of dollars, but created a concierge experience for our workers. And we're not alone. You've heard about legislation in Indiana, California, and Vermont regarding direct contracting, reference-based pricing, and transparency. If Californians can do it, Vermonters can do it, and the Hoosiers can do it, then you can do it too. I don't want to create the impression that all of our interactions between the 32BJ Fund and hospitals are antagonistic. We appreciate the magnificent work that hospitals perform. The issue is fair and transparent pricing and rational practices. While sometimes our relationships with specific hospitals have been adversarial, we have also engaged and tried to create alliances that work both for us and the hospitals. In my day job, I negotiate union contracts. Developing relationships, building trust, determining common interests, and coming to an agreement is my way of life. That can also be the way forward between payors and hospitals. Our fund has the ability to steer patients to hospitals, which will be beneficial to those institutions. On the other hand, we, like no one else in this room, like everyone else in this room, wants to get ripped off. Turning adversaries into allies is a process, but in the end, it's a win for all. Our fund pays reasonable prices, the hospitals get more patients, and our participants get exceptional care. So what's next? As employers, you have more purchasing leverage than you realize. Contracting accountability, centers of excellence, and transparent pricing are proven strategies. For policymakers, your leadership sets the rules of the game to protect us all. Help us fix the problem by increasing market transparency and enabling competition to protect those who pay the bill. For healthcare providers, engage with us as transparent and business partners. We want to make rational business decisions that work for everyone. As an employer representative, I know that healthcare costs can't continue to rise faster than other costs over the long term. That's just not sustainable. These conferences help, and we will continue them in the future. Like any endeavor, there will be successes, there will be failures, but simply accepting the status quo is not viable. For private payers, fight for your company, fight for your workers. For the government, fight for your citizens, fight for your taxpayers. And for hospitals, and I know there's a few in the room, I've spoken to you at all the networking things, don't be afraid to innovate and create new business models. The old playbook failed. Let's write a new one where transparency is a rule, fairness is the standard, and the business of healthcare makes business sense. At that point, the scoreboard will change. As Winston Churchill said, success is not final, failure is not fatal, it is the courage to continue that counts. Thank you for joining us in this effort.